Welcome everyone again to the University of New Mexico Law and Mental Health Series, weekly discussions of practice and science featuring experts in behavioral health and the law. This series is run by the Division of Forensic Behavioral Sciences of the University of New Mexico's Department of Psychiatry and Behavioral Sciences in support with the New Mexico Behavioral Health Services Division. I'm Anthony Perillo. I'm the Forensic Psychology Training Director here at the University of New Mexico. For our talk today, if you have any questions for our presenter, make sure you enter them in the Q&A box. Anytime you feel comfortable, you can enter those, but do know that we hold questions until the end. And also, oftentimes it's not possible for us to get to all of them. If you are pursuing continuing medical education credits, there will be a sign-in sheet posted in the chat box shortly. If you are pursuing APA continuing education credits, the link for that survey will also be entered into the chat box, but in the latter portions of the talk near the end of the hour. So keep your eye on the chat box near the end of the hour. If you're not going to open the survey right then, make sure that you bookmark it for a later point, and make sure that you save a copy of your completed survey after the fact, because we don't have access to those completed certificates after the fact. If you missed last week's talk in the series, Dr. Kevin Baldwin's informative discussion of the past, present, and future of mental health courts is now available on our YouTube channel. The recording for this week's talk should also be available on our YouTube channel later this week, and the PowerPoint slides accessible for people that have registered for the series later this week as well. As a heads up for next week, we have Dr. Lauren Coyce and Dr. Eric Elbogan, who will be discussing intersections of financial instability, severe mental illness, and involvement in the criminal legal system. But circling back to this week, I'm very excited to introduce you to this week's speaker. We'll be discussing practical strategies for enhancing cultural responsiveness in forensic assessment. This is Dr. Mina Ratkalkar. Dr. Mina Ratkalkar is a forensic psychologist in Durham, North Carolina, and a consultant on culturally responsive practices for attorneys and clinicians. She's a certified sex therapist who specializes in evaluations involving consent, sexual behavior, and neurodiversity. She's passionate about collaboration between researchers and practitioners to better serve justice-involved people and courts. Dr. Ratkalkar earned her Ph.D. in forensic psychology from Drexel University, her Master's of Science in Criminology and Criminal Justice from Florida Atlantic University, a Master's in Social Work from Columbia University, and a Bachelor's of Science in Clinical Psychology and Community Health from Tufts University. She's a licensed psychologist, licensed clinical social worker, and a clinical supervisor. So Dr. Ratkalkar, Mina, on behalf of the University of New Mexico, it's an honor to have you joining this series, and I'm very excited for you sharing your expertise and this particular angle on cultural responsiveness with us today. I'll go ahead and throw it over to you.
Great, thank you for that introduction, Anthony, and I'm going to go ahead and share my presentation. I hope everyone can see it all right. I am excited today to talk about practical strategies, but first, some of the housekeeping. I don't have anything to disclose in terms of financial, just anything financially to disclose. And sorry, one moment. And the important part here, if you want to receive any continuing education credits, please go ahead and follow these instructions. The evaluations are going to close 48 hours from today. I don't have anything, anything to say that is on the behalf of the University of New Mexico, and this is all on my own behalf, and I welcome any questions. So the learning objectives for today. The first is to understand cultural responsiveness, so what it is, and also for everyone to walk away with a better understanding of what cultural responsiveness is. The second is for clearer ideas on how to apply culturally responsive assessment techniques. So some things that you can hopefully start to implement in practice or training right away. And then the third is to help recognize and mitigate cultural bias. So developing skills to recognize cultural bias in forensic mental health assessment, or FMHA, and also, again, practical strategies to mitigate it. And I'm going to be using a case study to demonstrate the application of some of these concepts, and also explain how we can use existing principles of FMHA to contextualize cultural information. This is helpful because we have things existing in our field. We have principles that have already been published, already established. So it's not reinventing the wheel, but more expanding our thinking about it. And I'm excited to introduce some tools. Some are emerging, some are existing, and put this into practice recommendations. The goal of this is to increase our objectivity in forensic mental health assessment. This can sometimes, I'll explain a little bit more, but being culturally responsive or even using those kinds of words can sometimes make evaluators seem slanted, and I'll be talking about some techniques to mitigate that. And just so you know, I will be clicking through some of the slides to share information and to properly credit colleagues and people who are doing work in this field. But for the practical focus, there may be some that I move through more quickly and some that I spend more time on. So first, instead of like a typical study, let's start with the limitations. First is that we don't have that much guidance from the field of forensic psychology yet, but more and more work is being done in this area. And I'm going to, in the next slide, talk about a recent study that gives some ideas into promising practices. And there's some work going on right now looking for forensic assessment tools that do explore racial trauma. So work is ongoing. But we also need to keep in mind that forensic mental health assessment requires a lot of decision-making and a lot of information to take in. There's so many moving pieces. It's not like a lab study with reproducibility for a specific protocol. So as we aim for consensus and objectivity, there are a lot of judgment calls that we have to make. And there's a lot of advice to check our bias, and some of that you may have heard things for self-reflection or ideas to start with that. And while it's a good start to thinking about race, culture, and ethnicity, it doesn't really work to mitigate bias. And here's quickly a chart pulled from Amanda Phaneuf and colleagues' paper in Law and Human Behavior. If you haven't read it, I encourage you to. They identified 28 practices that had expert consensus for being included in culturally informed forensic mental health assessment. And this talk builds on this work and other types of studies before it to help think about how to do some of these, especially the ones that say consider cultural factors or consider your own limits. I really hope that everyone can walk away thinking about here's how I will do that, or at least to have a better idea. So DEI, again, like limitations, DEI or diversity considerations or cultural considerations can often be tagged on at the end. And it's not a limitation or an inconvenience or a footnote. So let's put it front and center. DEI, diversity, equity, and inclusion. First, I just want to briefly go through some terms that I will be using or you may see in the literature on culture, race, ethnicity, and cultural responsiveness. So in the United States, that's a cultural context that I'm presenting from. We use the word BIPOC, Black, Indigenous, and people of color. Ethnicity, a social group with shared culture, language, and/or a place of origin. Race, a socially constructed political system that categorizes people into different groups based on perceived physical differences or recent ancestry to create and maintain a power hierarchy. And racism is an organized system within societies that causes avoidable and unfair inequalities in power, resources, capacities, and opportunities across racial groups. Just a quick note that I recognize that these definitions of race and racism, I've cited the sources below, that they go beyond, oh, race is a social construct. It's important in FMHA to recognize that we are assessing the impact of a system and a system that's intended to maintain existing hierarchies. And for shorthand, I will be using race, ethnicity, and culture, REC. You can't really disentangle one from the other. And so that's just an easier way to refer to it throughout this presentation. Some of you may be familiar with the concept of intersectionality. And it's the cumulative way that all of the different aspects of our identity, our race, our ethnicity, our socioeconomic class, all of these things interact to change how people may perceive us or how we perceive ourselves, and more importantly, how we move through the world. And when we're evaluating people, we really want to keep these in mind. Some background, cultural terms here. You may be familiar with the term cultural competence, and that's a required part of teaching in APA accredited programs. So being aware of culture, knowledge and skills to put behavior in cultural context, familiarity with clients or examinees' culture. Then, since the term cultural competence became more widely used, the concepts of cultural humility and reflexivity also were added to it, with the understanding that this is an ongoing process. It's constantly in flux. The terms that we use, but not just the terms, but the experiences that people have can change. So cultural responsiveness is what we're talking about today. The continual development of knowledge, awareness, reflexive practice, and skills needed to promote health, well-being, and equity for diverse individuals and communities. And now that is a mouthful, but what that means for FMHA is that it requires us as evaluators to be responding and asking questions. And once we get more information, making it a dynamic process that we're never quite done individually as professionals, but also in each evaluation. What does this mean when we get new pieces of information? What does it ask of us? And I mentioned this a little earlier. What happens if this gets political? FMHA, when we do FMHA from a culturally responsive approach, it's not saying that you as an evaluator are advocating for a specific person. It's not saying that you're advocating for specific social values or beliefs, especially those that you personally have. And it's in no way saying that an evaluation should be a vehicle for a particular social justice agenda. So even if it does end up enhancing social justice or increasing awareness, that's not the full intention when you do a specific evaluation for a specific client or work with a specific examinee. But this is asked of us in the specialty guidelines for forensic psychology that were published over 10 years ago. And the latest revision of the DSM-5 is much more explicit that we need to consider these things. And I do recognize that we can, as evaluators, potentially trigger bias by mentioning race or culture. But I argue that that's not enough of a reason to not include it, because there are so many different pieces of information we include, and it is so hard to know what may trigger certain biases on the part of the reader or audience and what may mitigate that. And so by including this cultural information or REC related information, we can give a more informed report and conclusion. So these next couple of slides just talk about or depict graphically this type of subjective information we may get. Some of it may be subjective, some objective. And depending on who we are or the mindset or background we're coming from as evaluators, you could have different interpretations. This next one looks a little messier, but it's still an oversimplification of the decision-making in FMHA. It just highlights the mix of subjective decisions and interpretations and the influx of objective information, all of the different things that we're required to weigh, including test selection and interpretation and the order in which we review things. Should we just review things as they come because we need to get the report out the door? Or are there ways to be more thoughtful if we have the option on the order in which we review things or how much weight we give to each one? These are just kind of questions that are inherent to any FMHA. So for potential next steps, there's a lot of stuff we can't change. And I wrote some of those here. We can't change what we've done so far. We can't change which tools exist in our field and which ones don't. We can't change how much practice we've had talking about our own identity and others' identities. But what we can change are using established principles and tools to improve our forensic decision-making while our field works toward coming up with more specific forensic mental health related tools. And also have some more guidance and training toward increasingly expansive thinking about culture, race, and ethnicity. Really figuring out, what does this mean? What does this information mean, and how could it be relevant to FMHA? So when I refer to these principles, I published a paper last year with some of my colleagues at Drexel, and 38 established principles have been published. I have the cover of the book there, The Principles of Forensic Mental Health Assessment, these foundational principles. Of these 38, 12 are especially relevant to incorporating race, ethnicity, and culturally related information. And the paper I wrote focused with my colleagues focused on racial identity, but the principles can also apply to cultural and ethnic identity as well. So the first general principle, my practical guidance is, if you haven't already started, start individual data collection. I don't have a set template because this can look different for everyone, but in general, be mindful of who sends you referrals. Is it the defense, the prosecution, both, or in what proportions? What's the background of the examinees that you're asked to evaluate? And that doesn't just mean race or ethnicity. You can track any meaningful information or demographics that are helpful for your practice. Are they people who are deemed indigent by the court? Are they people who are accused of specific types of offenses? Who is coming your way? And regardless of your stage of training or career, it's always helpful to have a variety of colleagues in your network to consult with. And this is not a coded way of saying find colleagues of color. It is helpful to have colleagues at different stages of their career with different perspectives, because we don't grow or learn in echo chambers. So really diversifying who we are talking to. This, Dr. Dror and colleagues did a lot of research on different sources of bias in forensic decision-making more generally. And I'm not going to go through this whole pyramid, but I'm going to focus on a few that are especially relevant. So one of the most acknowledged biases among evaluators is adversarial allegiance. If a report or conclusion is sympathetic to the side that hired the evaluator, that can affect how the evaluator interprets information related to REC, whether the information is interpreted more favorably or not. It can potentially bias us. And for education and training, APA accredited programs have multicultural education as a requirement, but it varies so much by department. And sometimes it's just one class, and most of the training in forensic psychology is done in traditionally white institutions, and the diversity in perspectives among faculty can vary pretty widely. Now, personal factors. We can't change, as I mentioned before, we can't change that we come into these conversations and evaluations with widely different levels of exposure and familiarity to different cultures. We may have different levels of fluency in discussing our identities. So I am an Indian American woman, and I have a lot of practice talking about my cultural background, because for my whole life in the United States, people often ask or demand some explanation about my name, my complexion, where I was born, where my family's from, and I'm used to it, and I can rattle it off easily with no preparation. And this life experience does make it easier for me to enter into conversations about race, ethnicity, or culture with other people, personally and professionally. And I'll be explaining a little later in this presentation how to gauge and account for some of these personal factors. And again, yeah, and also a lot of variation and exposure and familiarity with people across cultures. Sometimes we're from homogenous communities. Other people may, and some of our colleagues may be from communities that have a lot more diversity. So I find it helpful to when I'm talking about practical things, to start with practice as the emphasis. I'm going to start with a case study, and throughout the rest of the talk, I will be interspersing some of the content with how I applied it in this case. So just a little bit of background. I got a call from an attorney asking to assess capacity, his client's capacity to stand trial, and that's the language we use in North Carolina. And he said, my client says he's Black, maybe Cherokee, but it's hard to tell by looking at him. This particular person, this client of his, was a cisgender man in his 30s. And the lawyer told me he doesn't trust anyone. He says he doesn't trust anyone. And I have no idea. I have no idea if this guy's going to work with me. But he has a serious charge. He's got a triable case, and I think we should. And sometimes he seems with it, and sometimes he doesn't. And I just want to have him evaluated. And I will be explaining how I worked through this case. But the outcomes of it were that I had to assess experience of overt and covert racism. So things that anybody would say, yes, this is definitely racism, and others that are a bit more ambiguous. I, throughout the assessment process, elicited his thoughts about his identity, and I ultimately determined that he did not have capacity. I included a section in the report called Identity Context to explain the interplay of some of these REC-related factors. So my second practice tip here is to always remember the forensic question. What are you being asked to do? Race, ethnicity, and culture could be relevant to the forensic question, but they also may not be. And what the question is changes the scope. So in the case of competency or capacity to stand trial, that's a much more narrow focus than, let's say, an evaluation for mitigation in a death penalty case. We always should consider that cultural information could be relevant. Dr. Riggs-Romain and Dr. Kavanaugh in their 2019 paper on reporting race and ethnicity in forensic mental health assessment said, always ask, sometimes write. It's helpful to have a more expansive and comprehensive assessment and to pick and choose the pieces that are relevant. So in this case study, I was asked to look at his capacity, and with some further clinical assessment, standard clinical assessment, he seemed to have some paranoid delusional thinking, both thinking that's related to his racial and cultural identity and thinking that was not. And what made it rise to that level was some of the language that he used, that everyone was after him, and the ways in which he believed everyone was after him. So I'm going to now go through some promising practical tools and with another guidance for practice here. This is standard forensic mental health assessment. Use multiple sources of information and actively gather the missing information related to race, ethnicity, and culture if you can. And I really want to highlight the part on the slide about actual and perceived safety and belonging. We really want to try to understand, how does the person you're evaluating move through the world, and what examines that? What impacts this as you're examining this? Really trying to get an idea of what are the situations or people that you gravitate toward? What are the ones that you don't because it doesn't feel safe? So a model that can be really helpful with this is the addressing model by Dr. Hayes. And this, when we talk about intersectional identities, the addressing model is one that really clearly breaks it down. And you can read all of the different aspects here, so I won't rattle through all of them. But she really touched on some really key pieces of identity. And in any of these domains, individually, we may have more or less power or privilege, and we are bringing those pieces of ourselves without much choice in the matter to the evaluation. And the same with the examinee. On each of these domains, age and generation, all the way to gender, they are bringing their life experience and identities to the evaluation. I thought for Hayes Helpers Toolkit, what I see a lot in trainings or literature is that we get much more of 1, 2, and 3. Let's recognize that we have bias and that we're all parts of larger systems. But much less, I believe, is said about points 4, 5, and 6. That we want to understand that people without privilege in a certain area are socialized to be aware of the lines between people who have privilege and those who don't. So in this case study, this evaluee, he used the words biracial, and he said, I'm half Black and half white, but my dad's side has some Indian too. And his complexion was lighter than mine, and he acknowledged that he believed that having lighter skin led to more privilege and just an easier life overall. And he was socialized to be acutely aware of this line. So to point number 5, privileged members are socialized to ignore lines and differences. And this is not just saying treat everyone equally or colorblindness. If we have privilege, often we're taught not to talk about it. Don't look, don't stare, don't bring it up because it's rude. So if we take the example of mobility, most people with full mobility might open a door for someone who uses a wheelchair, but it would be considered rude to talk about it or to ask questions. And as a result, that people who have never even had to consider using a wheelchair are just missing large swaths of information about a day in the life of a person who uses a wheelchair. And after that person who with full mobility opens the door, they probably don't have to think about how they are going to access the next building. So someone with more privilege is socialized to ignore these lines. And number 6, privilege and non-privileged. Privilege and not having privilege separates people from important information about one another. It's essentially 2 different realities. So one common example is cisgender men and cisgender women often have different lived realities on how to manage the threat of sexual violence in public or in dating or in pretty much any space. And many cis men tell me, oh, I only realize how pervasive this is through the women in my life. So things like sharing your location when you go out, not walking alone, all of these types of things are things that unless there is an informant from the side with less privilege, the person with more privilege is unlikely to know. I thought this worksheet was particularly helpful. So this was put out by McLean Hospital and clinicians at Harvard in one of their trainings, and it's publicly available. And they acknowledge that the terms used here are not comprehensive and can be fluid or flexible. But I wanted to take a closer look at this, that it's not just saying, so with the addressing model, with the example of sexuality, it's not just saying, okay, what is your sexuality or your orientation? It's asking the respondent, do you have more or less privilege societally because of this? Is this something that's visible? Is this a part of you that can be concealed? Is this a fixed characteristic? Is this fluid? And asking these kinds of detailed questions can much better answer the questions of how important is this to FMHA. I'm not suggesting that you hand this over to someone, but I've used it for helpful jumping off points in clinical interviews. So for example, when I'm evaluating people, so I evaluated somebody last year a man who identified as gay. He told me that he felt so much more visible than he ever wanted to once he came out, that he lost what he said, his invisibility cloak, that he had the privilege. He didn't use the word privilege, but he said, I used to just be able to be myself. And now I'm just gay me. That's what they see first. I'm a queer person before I'm a person. But he said, I'm a normal enough looking guy. And it's not, unless I'm with another guy, a lot of people don't think that about me. So I don't get hassled as much as some other people do. And information like that really illustrates how some of this can be so fluid, moment to moment, where people's sense of safety is. Or if someone's neurodivergent, you can't always see that And you may not know until you start talking to somebody or read a record that suggests that. So in the case that I'm going through, this particular evaluee, he felt that his race was visible, but sometimes concealable, because he said people don't always know what I am, and said that it was both a strength and distress because he had pride in his heritage. And he said, I think about my identity a lot. Now for this principle of FMHA, do not become adversarial, but present and defend your opinions effectively. When you're talking to someone you're evaluating, you can explain why you're asking some questions to better understand their life experience, or since you're not in their shoes, you want their own words, even if they don't think they're explaining it correctly. Or in court, you can explain why you included certain pieces of an assessment or some cultural information if a justification is asked of you. You can answer, I had to assess because it may or may not have been relevant to answering the forensic question, but by not asking, you would never know. So here I want to pivot to describing a practical information management tool that I have been using for almost 2 years. And I'm going to go into more detail in a minute, but it's a worksheet designed to help with documenting the information that we consider in FMHA, the order in which we do it, and how we consider and judge that specific piece of information. So linear sequential unmasking expanded, or LSUE, it's a systematic way of considering information in forensic analysis. And the goal is to improve forensic decision-making and filter out noise that can distract from the task at hand. And by doing this, it can help us better answer the forensic question and have more transparency. Now, we all know we are capable of making quick and biased decisions, not just about REC, but maybe about anything in FMHA. If an evaluator gets a lot of the same types of referrals, they may start developing bias shortcuts to confirm their pre-existing practice and beliefs. So that's where type 2 processing, that's slower, can actually be unhelpful if it's not checked. As evaluators go through reports, it is important to think about a variety of different possibilities. How useful is a particular piece of information, whether it's culturally related or not? How important is a particular piece of information to answering the forensic question? What about if the first thing you consider is wrong? What if you think something is important, but it's not? And what would that mean for your conclusion? All of these possibilities, or even taking the time to consider them, can reduce bias. And debiasing is hard, but techniques like considering the opposite of our thoughts and conclusions have been shown to genuinely help mitigate bias. So unlike self-reflection or other maybe more feel-good techniques, being a bit more critical and considering the complete opposite can be helpful. In a recent presentation by Dr. Cougar and Dr. Miller that they presented for Concept talked about using LSUE in supervision training. So there are a few different applications of LSUE for FMHA. Now this is the original worksheet that my colleague Adele Quigley McBride developed. She's on faculty at Simon Fraser University in British Columbia. And she intended it to be a practical worksheet to help answer the question, how do people use LSUE? And she developed this worksheet for a forensic analyst. And you'll see that it asks for the user to rate irrelevance, so to assess whether the information is essential to perform an analysis correctly for a forensic analyst. So for example, in a lab, to look at biasing power, or how suggestive a certain piece of information could be, or how strongly does it imply that a particular outcome is best or most likely. How subjective is a piece of information? How many different interpretations or outcomes could this information be molded to support? In different types of forensic analysis where people are working in a lab, it's a little bit more straightforward. But in FMHA, less so. So recently we adapted this worksheet for FMHA, and it's an ongoing process. So what I'm showing you here may change. And we're also working on collaborating to develop some studies to get empirical data collection around its use in FMHA. So now I'll just go through some of these adaptations. And in my personal practice, I found it helpful. So first, in the heading that said explanation of any potential for bias, that became impressions or notes or running hypotheses, and to consider cultural factors if applicable. And what I just put on the slide there, that so much of what we get as forensic psychologists is biasing and relevant. So it's a little harder to tease some of this out. So we changed that first one, as I mentioned, from explanation for any potential for bias to impressions, notes, or running hypotheses. Consider cultural factors if applicable. So this is kind of a catch-all to help explain and have some transparency around what we're thinking as each piece of information comes in. Now, the next adaptation was adding perceived credibility. That we do get a lot of subjective pieces of information, and evaluators, without documenting it anywhere, we may say, oh, I'm going to pay attention to this, but not to this, because the way that nurse was writing in that clinical note, I don't really trust what they were saying. There are so many typos, it doesn't make any sense. Or someone may say, I don't know if I believe in this arrest affidavit. How likely is it that somebody dropped 3 bags of cocaine on 3 different days? I don't believe that. Or someone might say, I read this other person's report and it seems really well done to me, and I think it should get a lot of weight. And all of these can factor into perceived credibility. So adding that. And then the next adaptation was, instead of the heading, steps taken to prevent, mitigate, or identify the effects of bias, we changed it to steps to identify or mitigate potential bias, with the specific prompt to consider the opposite, or to consider order effects. What would this have mattered if I looked at this earlier? We can't change the order that we already looked at things, but we can at least pause to see or even consider, would this have made a difference? And on the evaluation level, that it is important to assess clinical characteristics in relevant, reliable, and valid ways, and legally relevant behavior. So going back to the scope, what is the question? What are they asking us to answer? Someone who refers to an evaluator, what do they want us to tell them? And that will define, or better help define, what is legally relevant. Now, the relevant, reliable, and valid ways, that can matter for test selection. We should be thinking, hey, is the test that I want to use, was it normed on the person or the type of person that I'm evaluating? Are there concerns about literacy? Are there concerns that it may or may not be culturally appropriate? And the model that I mentioned over here, this was mentioned in the talk on Friday, the interdivisional training on culture, on REC in FMHA, so very similar topic. And they had mentioned the multidimensional model of broaching behavior, that in psychotherapy, that broaching these topics can elicit information useful to clinical goals, and sometimes not doing that can, or inadvertently silencing people, can be lost opportunities for really necessary information. And that also applies to FMHA. So beyond assessing the factors in the addressing model, it's really important to also take a look at what you see and experience from the evaluee. So this is where our clinical judgment comes in. When you're taking a look and saying, okay, could there be a different worldview that they have versus what I have? Could there be the way they show distress, is that potentially different? These are all just kind of open-ended questions to consider. Now, this tool is called the Yukon Racial and Ethnic Stress and Trauma Scale, so UNREST for short. These are some actually, I'll go back. The UNREST is a measure of racial trauma, and Chelsea Jackson and her colleagues at Drexel recently conducted a study looking for measures of racial trauma appropriate for FMHA, and UNREST was the only one that made the cut. And when this is published, I'd really encourage you to look at their methodology, because they did a pretty comprehensive search for different existing tools, and the UNREST was the only one that seemed currently appropriate for FMHA. And the UNREST follows this general format. So the introduction, racial and ethnic identity development, and asking about all of these different experiences of direct overt racism, racism by loved ones, vicarious racism. So some examples of those things are, if you didn't personally experience it, but you learned that your brother was stopped by the police and yanked out of his car, what would that do to you? If it never happened to you, but you learned that somebody from your community was gunned down in a hate crime, what would that do? What would that do for you? What would that do to your overall level of fear, your overall level of trust? And the racial trauma assessment, it also checks to see, does this meet criterion A for a diagnosis of PTSD? But I do want to stress this, that you do not have to have PTSD, or someone does not have to have PTSD for racial trauma to, let's say, count as traumatic. So here are some sample items. I did administer this measure to the men I evaluated in this case study, and it got some really meaningful information. It elicited some things that were critical for my evaluation. I better learned how he experienced his own identity and how he thought others experienced it. He told me he did not feel at home in Black communities or white communities, but was generally accepted on the sidelines of both. He gave some pretty devastating examples of how he and his family had experienced severe and overt racism, and family members individually corroborated his accounts. And he said, as a biracial person, he had experienced police encounters when he was with groups of white friends and with groups of Black friends, and also saw firsthand how people changed their interactions with him when they learned he was biracial, if they didn't already assume it. He said people completely change, or if they realize that I'm quote unquote one of them in an all white group, that suddenly they might stop saying certain things because they thought they were in a group of just all other white men. And when they found out that wasn't the case, he was treated a lot more coldly, and people kept things a lot more superficial. And these were things that he saw firsthand. So he said, I've seen racism from all sides. And he said, in some words, as an insider to it, by being able to go back and forth between communities. And this contributed to his paranoia. And he did say in our evaluation, and he smiled, he said, it makes me feel better though that there are other white guys in jail. So maybe it is more fair than I think. So back to some practical tips. I did use the UNREST with this particular examinee, and I used a lot of open-ended questions. So how often have you experienced discrimination or negative experiences? This is not a scale, but if somebody is struggling with, what do you mean, how often? You can use something like this, of never to very often, to help start the conversation about negative experiences. Somebody may or may not use the word discrimination. I would recommend not using the words racial trauma when it's just somebody's lived experience. It's just how they are and how they live. So it's not bad to say discrimination. It's just that some people may not digest what has happened to them as that. So asking in open-ended ways and trying to use simpler words, regardless of how intelligent the person seems, that's not the point. It's to be as accessible as possible. Now, when it's, what do you ask open-ended questions about? beyond those REC domains that I talked about already, that this model I have found helpful. This is one that was pretty central to my social work education. It's the ecological systems theory by Yuri Bronfenbrenner. And in FMHA, I'd say a lot of evaluators are pretty used to asking about the most proximal things, family, religion, peers, but asking about someone's sense of safety in their neighborhood, or how they were raised to feel about the law, or law enforcement in general, or about fairness. What are their beliefs on fairness and application of the law and punishment? What does it mean to be a man in someone's specific culture? Is that person's definition of what a man is it the same today as when they grew up? Hearing all of these things in all of these different levels can much better inform any type of cultural or case conceptualization in FMHA. And in Friday's interdivisional talk, Dr. Anamba, she introduced a model of structural competence, and it's not the same as this exact model, but it gets at some of the same concepts, that being structurally competent. What are the structures affecting us and affecting our evaluees? What are these different levels, all of these different planes that affect who the person is in front of us? Now, practically speaking, we can't assess every single one of these things. And in the LSUE worksheet, I don't put every single one of these down, but I do make a point to ask beyond just the proximal family, so friends, peers, jobs. I make a point to go one or two circles out if I can. And there's very rarely a reason I can't. The only reason I have been unable to is if someone refuses to talk to me. So this next one, I won't spend too much time on this. I just want to put it out there that another helpful tool, I did not use it in this case, is a genogram. It's helpful for getting REC related information. There are lots of ways to do a genogram, and if you even do a simple Google search of genogram, you will find multiple techniques. And instead of worrying, I would say, instead of focusing on, should I use this system or that, or focusing on the lines or the dots, focus much more on the information that you get from each specific person. And the example that you see here is one I found online of what the artist Frida Kahlo, what her genogram would look like. And you can get multi-generational information. You can get information about culture. You can get information about how things have changed over time by generation or for individual people. And so putting this all together, again, in Friday's talk that if you didn't get a chance to look at or to attend it, it was very well done. The speakers introduced a good book about bringing up taboo topics with clients by Pope and colleagues. So if you're looking for more specific and practical language, I did get a chance to look at it over the weekend, and I would recommend it. In the case study, the person I evaluated, he readily spoke to me about everything related to race, ethnicity, and culture. So I didn't really have to preface much or explain why I was asking. He was actually eager to share. And it was pretty clear he had mixed experiences, positive and negative perceptions from others about his background and culture, and positive and negative perceptions on his own, of his own background and culture. He expected poor outcomes in the justice system, regardless of his attorney's race. So he told me, if I had a white lawyer, which I do, he probably won't understand me or where I'm coming from. But if I had a lawyer who wasn't white, they'd be dealing with the same stuff I am, with people not believing them or looking down on them. And by getting that information, I was able to put in the report that while he had suspicion of his attorney, that it did not matter what the race of the attorney was. And I wanted to highlight this technique as well. One last method I sometimes use, I did not use it for this particular person, but sometimes I use a map of the United States to learn about people's perceptions of safety, or local maps to learn about resources. So some questions I sometimes ask are, where would you want to live if you could live anywhere, and why? And that helps me understand what's important to this person. Are they saying close to family? Are they saying, I've never even thought about it, I haven't had a chance to leave? Are they saying, I'm going to live, I can only live in big cities, I can only live in the country? It helps you understand their worldview a little bit better. And then I ask the question, where do you think it's best or safest for someone like you to live, and why? And you may hear about their perceptions of a specific location or state. And I'll give an example that might make this a little clearer. So in my therapy practice this was years ago, I worked with a family in family therapy, and their son had recently come out as gay. And his parents said, we're really accepting, and we don't know why he's suddenly so nervous everywhere or with our family when nobody has changed how they act toward him. We all love him. Everyone's the same, and kind of saying he's making a big deal, much bigger deal out of it than we are. And so what I did was bring out a map, and it just something I decided to do in a moment, and I took a risk, and it seemed to land pretty well. And I asked the parents, that this was a white family, and I asked them, okay, other than preference for politics or cost of living, where could you live, is what I asked them. And they said, well, yeah, pretty much anywhere. And then they said, well, yeah, we don't like this weather, but we could live anywhere. And I asked their son the same question in front of them. And he said, in major cities, maybe along the coast, maybe San Francisco, because I feel unsafe now in the rest of the country. And it was really eye-opening for them to hear him talk about, yeah, if I have a boyfriend and I stop at a gas station with him, depending on where we are, I might feel scared. I might feel scared that someone will say something. I might even be scared for our lives. And until I made that difference in perceived safety and privilege more visual, it can be really hard for even the most well-meaning people to see. And even though I did not use this approach in this case, it has been helpful for my clinical practice. And so finally, written communication. In this evaluation, I did write a section called Identity Context to explain the evaluee's racial, ethnic, and cultural identity and the related mistrust. And so the established FMHA principles, writing the report in sections according to models and procedures. We don't really have models yet that systematically include RAC-related information, but we can include some of these sections. We can fold it into social history, we can fold it into family history. It doesn't always need to be a separate section, but, and you can decide on your own, is this something I want to highlight in its own way to make more complex, just more complex observations, or is this something that I just want to make sure is included and seen? And my conclusions in this evaluation and recommendations, they included this examinee's signs and symptoms of psychosis that were exacerbated by his lifelong experiences with racism. And I ultimately thought he did not have capacity, and his lawyer was much better able to understand why his client responded the way he did and to communicate with him better, because he had a level of acceptance of his client's mistrust and fear and where it came from. And so that's all I have for you today. Take a moment to look at this QR code or to take a picture of it.
Well, thank you so much, Mina, Dr. Ratkalkar, on that very helpful overview and navigation between aspiration and specific case studies. I can say, as a oftentimes ethnically ambiguous person myself, that I resonated a lot with some of the discussion here. We have a number of questions here already. Some about LSU a little bit more broadly, some about some of the more specific issues here. As Dr. Ratkalkar noted, the QR code is here in the chat box. We also have the links to the CEU surveys as well. Here is Dr. Ratkalkar's contact information if you would like any further to contact her directly. Some people asked a couple of questions about court buy-in to some of this approach. And so I'll consider two questions here that people had here. Somebody said, how do we help the courts care about all this information in the same way we do? There's still a resistance to acknowledge disparities in the legal system, even from those that are working within it. And then somebody added, I appreciate your work in this area, but prosecutors and judges are more concerned with validated risk assessments with probability estimates. They never appear to be concerned about ethnicity or sexual orientation. They focus on risk. So I guess all this together gets at like any thoughts that you have about court buy-in and receptiveness.
Yeah, no, these are good questions, and certainly it is helpful to be mindful of who your audience is and have that reflected in the language that you use in your report. So if I know that, and this is not me twisting my conclusions or anything like that, it's more, again, just making sure that my same message is received how it's intended to. So something like identity context, and I work in the South, a more conservative court, I probably won't put that there. I might just fold it into family or social history so that it doesn't raise a flag necessarily of, oh, she's talking about this race stuff. She's making it about race. I'm familiar with those ideas, and part of, so the court buy-in, you point them to the guidelines of, I'm supposed to do this. These are the guidelines for forensic practice. We're supposed to be doing this. And that, and that's why the established principles, I worked with Kirk Halbrin and Chelsea Jackson on that paper, where we were saying this is not reinventing the wheel. This is not special topics. These principles have been around for a while, and this is just a different application of them. So that can also be helpful with risk assessments. That certainly, and I know that there are people who do a lot of research in this area, specifically on race and racial bias and risk assessment. So I'm not going to speak out of my lane here, but that having, I would say in situations where okay, there is a risk assessment and I'm being asked to do a risk assessment, and I often am, especially with when somebody is accused of a sex offense, I'm often asked to do that, or a violence risk assessment, to make sure that you also have a lot of clinical information that maybe is more subjective. So again, not to prove your point that, hey, this is valid, but to collect it so that you can make the judgment as the evaluator, how valid is this? And if I have this risk assessment result, how am I going to, or how do I, I'm not even going to say want to, how do I need to contextualize it so the court has a more informed idea?
Wonderful. Thank you for
So
that.
both, presenting both.
Focus. Yeah, that centers it back on the evaluator early in their process to have this info to integrate, let alone how they would communicate those results later. In terms of linear sequential unmasking, somebody asked, what's your experience been using it in these evaluations? It sounds really helpful, but have there been some difficulties implementing it into your daily practice?
I would say at first it seemed, so a little bit of background. I just happened to meet Adele when I went to a book talk at Duke Law, and she was a postdoc there at the time. And I asked the question, how all of this stuff about bias and how to mitigate it, that sounds good, but how do I actually do it? And the professor pointed to her and said, talk to her. And she had recently developed this worksheet on how to make this more practical. So I will say that it was easier for me to fold into my practice because I was a volunteer to do this. Nobody was telling me to. And I will say, though, that because I am a practitioner, it was important to me that it was quick and dirty, that this was actually functional. So I use it with quick notes. And it's been really helpful for me on the stand, actually, when I had somebody ask me, well, what if you had considered this instead of this? Or what if you had looked at that first? Or well, is it possible that you looked at that piece of information and then you did this? And I was able to say, no, that's not what happened. I looked at this on this day, and I did consider, well, if this is true, then X. If it's not true, then Y. And it just gave me a lot more, it gave a lot more transparency even for myself to say, okay, here's how I made this conclusion. So to answer that person's question, it has been surprisingly easy. And the ratings, they are purely subjective. And when I have enough of these, I don't use it in every case, but especially for cases that seem routine, where I know I am at highest risk of developing bad habits, of thinking I know what I'm doing, I'm more likely to do that. And also when I am facing a referral question, or that there's something about the case or the examinee that feels kind of unfamiliar, to make sure that I'm doing my due diligence, I'm most likely to use it. But what was most important to me is that it's quick, because there's so many wonderful ideas that are put out by researchers for here's how we can improve practice. But if they're not usable, they're not going to work. So it's been 2 years now that I've been using this, and recently we adapted it. And I would say overall, as far as I'm concerned in my practice, it's here to stay.
That's wonderful to hear. Yeah. Out of curiosity, how might type 2 processing exacerbate bias?
Well, just that is a good question, because sometimes we can still have our confirmation. We can still have our own biases of how we think things are supposed to go, and think, okay, let me do the right thing. Let me really slow down and just keep more slowly getting confirmatory information and reading more and more sources, or more and more literature in echo chambers. And it is important. So to the first question of, well, what about when people don't buy this? That is kind of the stance that I write from sometimes, is let's assume that nobody cares about this culture stuff and they think that I'm making it about race. And that's the stance that I take, because that's who I have to convince, not to necessarily believe my opinion, but to say her opinion is, and not that I need to convert anybody, but I need them to believe in my credibility, if that makes sense.
Certainly. Thank you.
Yeah.
As we wrap up here, one final question. Somebody asked, do you query white evaluees about their racial, cultural identity, et cetera? And I guess I would add, if so, how those, from your experience, how those conversations have differed, if at all?
I do. And when I talk about culture, I don't use unrest, because it's specifically intended to be used with people of minoritized identities. But when I work with white evaluees, I do ask about culture, but I might start with family culture, and then ask questions about gender, questions about religious culture. And certainly there are plenty of white evaluees I work with who certainly do not have power in a lot of aspects of their lives. And if I say, oh, tell me about your culture, yeah, usually it's just dead. It doesn't really go anywhere. But if I start by asking about those aspects of culture, then it's a much easier in.
Wonderful. Well, Mina, thank you so much for that helpful information and overview, as well as doing the work you do, and this weaving back and forth of delivering information for the field, letting it influence your work, and then letting your work influence the field. So thank you for all your approach for this. It's much appreciated. That wraps up this week's Law and Mental Health series. Next week, we have Dr. Lauren Coyce and Dr. Eric Elbogan, who will be discussing intersections of financial instability, severe mental illness, and involvement in the criminal legal system. We hope to see you then for another great discussion of issues in behavioral health and the law. Until next time.